Hi, I, Dr. Krithika Rao, host for today, welcome you to the Sunflower Children's Network podcast, a podcast series dedicated to advancing children's palliative care across the globe. At Sunflower Children's Network, we believe that meaningful change happens when passionate professionals are supported to lead within their own contexts. Through the Two Worlds Cancer Collaboration Leadership course in Children's Palliative Care, healthcare professionals from diverse regions design and implemented projects that respond to real gaps in care. Today's podcast brings those leadership journeys to life. Let's hear from Ms. Vinutha from Chennai, India, in today's conversation, whose project focused on creating a structured bereaved parent support program within their institution. Hi, Vinutha. Thank you for joining here with us today.
Hi, Krithika. Thank you very much for this opportunity to talk more about and share my experiences about this project.
And as you can imagine, being in this field, you would have seen that grief after death of a child is profound and lifelong. And yet, there's no structured bereavement care services, in many parts of India. What made you recognize the need for a dedicated bereavement support program in your institution?
Yeah, thanks for asking this question, Krithika. I work for Cancer Institute Adayar. It's a tertiary cancer center. It's a regional cancer center in the southern part of India. Our institute has a considerable number of pediatric patients. And as a palliative care psychologist, I had the opportunity to meet and talk to all these children, most of these children and the families. Their need keep changing during every stage of the disease, I agree. During some part of the disease trajectory, the child passes on, not responding to the treatment properly. And we do counsel the families extensively during their anticipatory grief stages. We do make bereavement calls post death. Few families talk to us, few don't pick up our calls, they block our numbers, they don't want to relive the trauma. Few families request us to not call them anymore. To note that all these calls are made by our counselors, social workers, physicians who had best rapport with the families. Despite that, we did not have a proper structure to make those kind of calls. We didn't have a proper protocol. We didn't have a proper guidance on how to make these calls sustainable. This was purely the calls, whatever calls we made, it was purely out of our interest, based on our memory that we make the calls. But sometimes, due to immense workload and new patients in our radar, this just did not happen the way it was supposed to happen. As you know, bereavement support is a part of important part of palliative care. Some of the families reach out to us randomly after many months for some support for the siblings due to school avoidance, husband reaching out to us saying wife is not normal as before, mother wanting to know that she has she done enough for the child, and another parent will want to know whether they can have another child. So each one of them felt that there is certainly a need for bereavement support, and certainly palliative care is incomplete without bereavement support. But how do we provide it? What does family want? In what way we can support them? This was the question, and when it was discussed in our interdisciplinary, multidisciplinary team, unanimously everyone agreed that there is a gap in this area at the institutional level. And many a times it was identified that not wanting to adopt the Western culture was only one thing that everybody was in sync. So that is how it started.
Wow, that's so profound. I mean, it's such a powerful realization that you wanted to continue to provide that care for those children, that you had been seeing them throughout their illness journey, and the realization that our care does not end with their death. And you also felt that the families need supported, because sometimes the silence after that child's passing can feel so overwhelming for the family, and they go through a lot and they have so many questions. That's deeply inspiring, to think of it in that way. You mentioned, your experiences with families and the way they would come informally to ask you. But then when you proposed this, did you counter some kind of any cultural barriers or institutional barriers?
Yeah, of course, there were a lot of barriers, Kritika. Needless to say, any new system which we are going to bring has a lot of questioning. But of course, this particular project, bereavement support project, no one questioned inside the institution. In fact, everyone was very supportive, very, very happy. They thought that there is a gap for bereavement support, but they were sure that it should not be of Western culture, like lighting candles or giving bouquets, sending letters. This doesn't work in our setup. Only thing everyone wanted to be sure of is it should be based on culturally grounded with our population and based on the needs from the parents. That is one thing everybody was synced in, and that is how it was planned also. There were barriers, of course, I have to say barriers. That is, even among the healthcare professionals, there was strong reluctance to discuss death with the families during active treatment phase. They perceived it as it is going to decrease the hope of the families. Some also said that our culture and our society is not tuned for that. We are more emotionally bonded. Families will not accept any support from external people, like outside of the families. So that was an important cultural barrier. Ours is like a collectivistic society. General sentiment, even among the healthcare professionals. And some were very much sure that the timing of introduction of bereavement only post death, not during treatment or not during end of life also, actively dying or after death. So that was something that we had to negotiate. There were also communication challenge. We were not allowed to give pamphlets or something so that it will send a wrong message to other parents who are actively going the treatment. So some of the barriers and challenges which we faced.
Absolutely. I mean, that is really difficult to navigate in those situations there. The clinicians caring for those children want to be able to support the families, but because of the understanding and, what can bereavement support really do and how does it really support? Since we don't have anything available in India, nobody has experienced it firsthand. And
Exactly.
that's why they probably not have how much of an effect does it have on the individual and the families to cope with the loss that they have. And as you rightly pointed out, it should not just start after death. The conversations around it, there's so much of anticipatory grief that families go through. So I just wanted to know that, were you part of any program that you had observed which had a similar structure, or elsewhere that you had seen a similar bereaved parents program that you felt that you could probably bring this back to your home institution?
Personally, I have not attended any bereavement support program myself, but through this project, I have done lot of literature review, collaborated with lot of other institutions nationally as well as internationally to understand what kind of bereavement support program is going on in their institution. But surprisingly, whatever I found was not any emotionally supporting bereavement support program, or not that which was formed based on the needs of the bereaved parents. The institutions were providing support, whatever they think is appropriate to provide for the bereaved parents. None of the parents or bereaved parents were involved in the process of developing the bereavement support program. That is what was missing, is what I felt. We were providing them social support, monetary support, other logistical support, but none were like based on the needs of the parents. So that's what triggered me to first of all do a assessment from the bereaved parents on what do the Indian parents really need after the child dies of cancer. So this was the premise in which we started developing this program.
That's really fantastic. I mean, like, you went back, saw what literature is available, looked through, as your institution also told you that let's not try to emulate what the West would do it, because, as you pointed, it has to be culturally appropriate. There would be a lot of things that our people in this region may not accept, might find that inappropriate in the way that it would be introduced to them, and which is why they would feel as a barrier to even turn up for such events, or be taken aback that why are you sending cards or why are you sending flowers, because that's not always in the culture here within India. Important also to keep in mind when we are developing programs, to see that how it has to be adaptable in the local context. It cannot be just brought in from somewhere else and just as is implemented. And as a leader, I think that's something that you kind of brought in those skills in, that you have to look at how you can build it from your own people, try to ask the people around here what is important for them and take that forward. Grief is expected to be handled within the family, and a structured support is something maybe misunderstood by other people, but having that sense of family here as well within the place where their child was cared for can also be so deeply impactful for them. So, Vinutha, on a personal level, how did leading this project change you? Because it's not easy dealing with grief of a loss of a child.
Right. So personally, apart from bringing changes to the institutional level, there are a lot of learning for me as a person, because I had some preconceived notions like we should have bereavement support program because it's a part of palliative care. Like I was like textbook following things as such. I'm a perfectionist. I spend a lot of time planning so that nothing falls apart during the course of the journey. So these things were in mind, but when this started, even the timelines, I stick to them and all those things. When this project started, immediately the thing I realized was only thing that was permanent is change. That is the only thing that happened throughout the project. We had to constantly change my route, shift gears, hit the brakes. Of course, I reached the destination finally, but all these things happened. So many times I have to take a U turn. So these were the things. I'm completely a reluctant, resistant person to sudden changes. But I learned that unless you change your course of the journey, you can never reach the destination if you are going to be very, very rigid. And I also learned that everybody have different perspectives, but not there is not only one way of doing things right. That is something I realized. I may think this is the right way of doing. There are a lot of other ways of doing things right. So that is something I learned as a part of this project. And having a bereavement support program is okay, but it should create benefit more than harm. Just because I should have one, I should not have it. These are the things that I learned through collaboration, seniors, people who had worked on it. And I networked among more than 100 people for this project and conducted more than 50 meetings for this project, which I had never done throughout my life all these years. So, at last, what I learned was even in a 72-year-old institution, it is possible to bring a system level change as a single person. As long as your motive is patient care, family care, nobody will resist to it. That is something I learned from this project this 1 year.
Vinota, I just love how intentional this is. I mean, you just said something which I was thinking in my mind is that bereavement care doesn't always require a large infrastructure, but that commitment, that empathy, and bringing in that structure with your leadership skills just made that profound impact in your institution. And what stands out to me from this conversation is that leadership in pediatric palliative care is not only about improving that medical care, it's about sustaining compassion beyond those clinical timelines, creating a space for remembrance, validation, shared grief, and you have expanded that meaning of care in your institution. So, thank you for reminding us that even after a child's life ends, the relationship with that family continues.
Thank you so much, Krithika. Thank you for creating this visibility. Constantly have been creating visibility on any good project.
Thank you for joining us on Sunflower Children's Network podcast series. This Sunflower podcast explores global pediatric palliative care, exploring new issues and engaging on questions about caring for children with serious illnesses and their families through a global lens. Offering discussions on the joys and challenges of palliative care, including topics related to education, advocacy, self care, and leadership from around the world. To learn more or to donate, please visit twoworldscancer.ca.